Mathematical modelling is everywhere. It guides investors in the stock market, it helps decide how to control traffic flow in our cities, and in healthcare, one of the main uses of modelling has been to figure out what to do if an influenza pandemic hit Australia. In January, the mathematical modelling team doing the influenza work had to pivot to COVID-19. The models released by the federal government yesterday are based on overseas, not Australian data, and reflected the early pandemic, matching what we already knew from modelling in countries like the UK, which is that doing nothing would have been a disaster and that social distancing is the single biggest measure you can take, alongside eliminating cases from overseas.
The modelling work is theoretical. It is not based on Australian case data and does not model Australian responses.
The model focused on the main anxiety early on, which was, and in fact still is, the impact of the pandemic on intensive care capacity and how to protect the healthcare system.
We are not predicting what will happen in Australia. These are tools for planners to use.
Professor Jodie McVernon is one of the leaders of the modelling group that the Australian government has funded at the Doherty Institute.
All of us as modellers were putting scenarios to our governments, those of us who were working with policy, that were jaw-dropping. We were taken seriously. The measures that were put in place early reflected that. And then it was about having an ongoing discussion about what this actually meant in terms of what could be done.
What the modelling didn't and doesn't do is offer a path to the effective elimination of spread, or in other words, driving it down to very low levels, which is what the New Zealand modelling has done.
So it's not impossible that they could get in New Zealand to, if not total eradication, but to real control sooner.
Models exist to allow health officials and decision makers to test the impact of the various choices before them.
So the modelling up to date has helped us understand what would happen if we didn't put in measures like social distancing, measures like quarantining, measures like border control. Now, modelling and all the other public health tools that we have at our disposal need to support us in looking, planning and preparing for eliminating this disease from our country and making sure we stay free of it as we start lifting those measures we put in place.
And let me remind you of how close and how far we might be to the elimination of spread. This is the graph we need to bend now that overseas transmission is disappearing. It shows, as an example, spread within the New South Wales community. The numbers are higher than they look because we haven't tested widely for community transmission until recently. The aim here is to bottom the curve, not flatten it. Professor Mikhail Prokopenko has developed a model which tries to do just that, taking the entire population of Australia into account, particularly focusing on how closely we stick to social distancing.
There is a clear divide between 70% compliance and 80% compliance. It's a transition. Right? So when you have those sharp divisions, it means you found a gem which clearly could be used in decision making.
And on that basis, namely 80 or 90% compliance, he thinks that we get to elimination within 2.5 months.
Clearly there are different camps here in terms of people who believe elimination is achievable and people who believe suppression is a goal. I think the measures for elimination locally would be incredibly intensive and difficult to achieve given just how infectious this pathogen is. You know, it will not be eliminated globally and we will have to face it again. So I think we need to be very honest about what would get us out of that position when the virus comes back. Personally, I do not believe that we could have a short, sharp period of activity and then resume our lives as normal.
There are growing pressures to relax social distancing very soon and get life back to some semblance of normality. But there are risks.
This is a highly contagious virus. So the distancing measures that are in place at the moment appear to be doing a very effective job of suppressing the rate of growth. But that's because they are in place. If we ease up on the virus, it is still what it is. It is still highly infectious. And this is why we need a considered approach to taking those next steps.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.